World Health Organization has just declared Mpox, also known as monkeypox, a global health emergency. This declaration comes as the number of cases in Africa has surged to over 14,000 this year, with 524 deaths reported, numbers that have already surpassed last year's figures. This decision follows an urgent meeting of the WHO's Emergency Committee and a similar declaration by the Africa Centers for Disease Control and Prevention. So what is Mpox and why is it a cause of concern? Let's find out. I am Shivangi and you are watching India TV. Mpox was first identified in 1958 during outbreaks in monkeys and traditionally affected those in Central and West Africa who came into close contact with infected animals. 2 years ago, WHO declared Mpox was an emergency when a form of the disease began to spread globally, largely among men who have sex with men. That outbreak was brought under control after behavior change and safe sex practices. Plus, vaccines help people at risk protect themselves in many countries. But Mpox has been a public health problem in parts of Africa for decades. The first ever human case was in Congo in 1970 and it has had outbreaks ever since. The current outbreak, Congo's worst ever, has seen 27,000 cases and more than 1,100 deaths since January 2023, largely among children. The disease causes flu-like symptoms and pus-filled lesions and is usually mild but can kill. Children, pregnant women and people with weakened immune systems, such as those with HIV, are all at higher risk of complications. This year, Africa has seen a 160% increase in cases and a 19% rise in deaths compared to last year. Now, a concerning new variant discovered in Congo has a higher fatality rate and is harder to detect, complicating efforts to control its spread. In Congo, this new variant has led to a disproportionate impact on children, with over 70% of cases and 85% of deaths occurring among those under 15. The country's healthcare system is already overwhelmed by other crises, including malnutrition and cholera. So why is Mpox a threat to the rest of the world? Well, the new variant is particularly alarming due to its rapid spread and limited knowledge about it. Mpox causes flu-like symptoms and pus-filled lesions, typically mild but potentially fatal, especially for children, pregnant women, and those with weakened immune systems. The emergency declarations aim to accelerate the distribution of medical tools and funding to Congo. Currently, Africa lacks adequate supplies of critical vaccines, with efforts underway to secure doses. WHO and the Africa CDC are calling for donations from countries with stockpiles to address this urgent need. Mpox thus poses a serious threat, particularly to the most vulnerable populations, but it is not as easily spread as airborne diseases like COVID-19. The key challenge now is ensuring that effective tools and resources reach those who need them the most. So was this video helpful to you or not? Do comment and let us know. Till then, keep watching India TV.